We are always fascinated by unexplained things that have happened in our world, whether it be strange occurrences or events with no logical explanation. We can't help but wonder about the unknown and try to figure out what exactly happened. Welcome back, everyone. Here today we will be exploring some of the most baffling medical cases that have ever been recorded. These mysterious illnesses and conditions have left scientists scratching their heads for years, so get ready to be amazed, confused, and maybe even a little scared as we take a deep dive into these bizarre medical mysteries. Remember to like and subscribe so you don't miss out on any future videos. Let's get started. Alien hand syndrome. Imagine reaching out to grab an object only to find that your hand moves in an entirely different direction. This condition is known as alien hand syndrome, and it has left many sufferers feeling like they have no control over their own bodies. The scariest part, doctors still don't know what causes it. Alien hand syndrome was first documented in 1948, when a man who had suffered a stroke began experiencing uncontrollable movements of his right hand. Since then, there have been only a handful of cases reported in the literature. Not only do patients feel like a separate entity is controlling their limbs, they also have no memory of performing the actions, which can range from simple motor functions like brushing their teeth to more complex tasks such as tying their shoes. But perhaps the strangest symptom is that the affected person will often report feeling as if an external force is pulling or pushing their hand in a certain direction, without their consent. For example, one patient described it as someone grabbing my arm and twisting it around. It really feels like an outside force is trying to make me do things against my will. But despite the fact that this condition is so rare, researchers are still working hard to find answers. They believe that damage to a part of the brain called the corpus callosum may be responsible, as well as lesions in other areas associated with movement and sensation. Until we learn more, though, alien hand syndrome remains one of the most baffling medical cases ever seen. The man who couldn't feel pain. Imagine living a life where you never experience pain, no matter how much harm comes your way. It might sound like a dream come true, but for those who suffer from congenital analgesia, it's actually a nightmare. This rare disorder means that you're born without the ability to feel physical pain, and it can lead to some truly bizarre situations. Take, for example, the case of a boy named Zion who was brought to a hospital in South Africa after he burnt himself multiple times and even bit off his own finger. When doctors examined him, they found that he had no reaction to a pinprick, a light stroke, or even a painful burn. After running tests, they diagnosed him with congenital analgesia. Zion's case is far from unique. In fact, there are other cases of people with this disorder who have done even more extreme things. One woman was able to gouge out her own eye because she didn't feel any pain or discomfort, and a man was able to stab himself in the chest several times without even flinching. You might think that not feeling pain would be a blessing, but in reality it's a curse. Without the ability to feel pain, you're constantly at risk of serious injury and infection, and if you're like Zion, you might not even realize that something is wrong until it's too late. Locked-in syndrome. Locked-in syndrome is a rare neurological disorder that affects the way our brains process signals between the brain and the body. It's an incredibly perplexing condition, and its symptoms can be both scary and heartbreaking. People who suffer from locked-in syndrome are often completely paralyzed, except for their eye movements. This means that they are aware of their surroundings and everything going on around them, but they cannot interact with the world in any meaningful way. They can't speak, move, or do anything to let others know what they're thinking or feeling. You might think that this would drive a person insane, and you'd be right. Many people with locked-in syndrome develop severe anxiety and depression because of the feeling of being trapped inside their own bodies. In some cases, they are able to communicate by blinking or making other small movements. But in other cases, they are completely unable to interact with anyone else, leaving them feeling isolated and misunderstood. As you can imagine, there is no one-size-fits-all approach to treating locked-in syndrome. Doctors must work closely with each patient to develop a plan that addresses their individual needs. And while there is currently no cure, there are treatments available that can help improve a person's quality of life. Split brain patients. Split brain patients are individuals who have undergone a procedure called a commiserotomy. This procedure is used to treat severe epilepsy that has not responded to medication. During the surgery, the corpus callosum, which is the bundle of nerves connecting the two hemispheres of the brain, is cut. By severing the connection between the two sides of the brain, doctors can reduce the frequency of epileptic seizures. But it also creates some interesting and sometimes bizarre effects. For example, When shown an image in the left visual field, a split-brain patient may be able to describe what they see, but when asked to identify the object using their right hand, they may not be able to do so. This is because the left side of the brain is responsible for processing language, and the right side is responsible for controlling movement. Therefore, the patient may understand what an object is, but they won't be able to use their right hand to manipulate it, because the two sides of the brain can no longer communicate. Split-brain patients are still able to perceive the world around them in most respects. However, they may have difficulty with tasks that require coordination between the two sides of the brain, such as playing a musical instrument or throwing a ball. Overall, split-brain patients are a fascinating group of people who offer scientists an unprecedented look at the way our brains work. Foreign accent syndrome, or FAS, is a rare speech disorder that can cause a person to suddenly begin speaking with an accent that does not match their native language. While the exact cause of FOS is unknown, it's thought to be triggered by damage to certain areas of the brain, such as the motor cortex or the supplementary motor area. This type of brain damage can be caused by a stroke, head injury, or brain tumor. Symptoms of FOS include speaking in a different intonation, stress, or rhythm than usual, as well as using different pronunciation and speaking rate. In some cases, individuals with FOSI may even begin to add phrases or words to their speech that are similar to those used in another language. This condition can be both perplexing and challenging for those who experience it, as well as for the medical professionals trying to diagnose and treat it. Due to its rarity, FAS remains a medical mystery, but ongoing research continues to shed light on its causes and potential treatments. Sleepless sleep. Imagine going through your entire life without ever falling asleep. You wake up every morning before dawn and go about your day with boundless energy. But as the hours pass, you become increasingly agitated and uncomfortable. Then, no matter how hard you try, you can't bring yourself to lie down and relax. If this sounds like a nightmare, then you'll be relieved to know that it is actually impossible. There are many documented cases of people who have gone without sleep for weeks or even months at a time. In fact, one man went 264 days without sleeping and another woman managed 11 days. While the science behind these cases is still not fully understood, it's generally believed that they occurred due to a malfunction in the body's circadian rhythm. This internal clock regulates sleep cycles and other bodily functions based on the 24-hour length of a day. When this system malfunctions, it can lead to severe insomnia and an inability to fall asleep. While the consequences of chronic sleep deprivation are dire, the good news is that it is possible to catch up on sleep. In some cases, simply spending time outdoors during daylight hours and avoiding bright lights at night can help reset the body's internal clock. Rapid eye movement sleep behavior disorder. Rapid eye movement sleep behavior disorder, or REM sleep behavior disorder, is a fascinating sleep disorder that can cause people to act out their dreams. This condition occurs when the brain enters the rapid eye movement stage of sleep, which is typically when dreaming occurs. Normally, the muscles in the body become paralyzed during this stage, but with REM sleep behavior disorder, this paralysis does not occur. As a result, people may act out their dreams, which can be dangerous for themselves and their partners. One can only imagine the potential consequences of acting on violent or disturbing dreams. It is thought that approximately 1 in 10 people experience at least one dream that they act out, although it is unclear what causes this behavior. Some researchers believe that it is linked to an imbalance of certain neurotransmitters in the brain, while others think that it may be caused by a lack of sleep or stress. Whatever the cause, REM sleep behavior disorder can be a serious issue and should be discussed with a healthcare professional. With proper diagnosis and treatment, however, most people with this condition are able to live relatively normal lives. These medical mysteries continue to baffle scientists and remind us that there is still so much we don't know about the human body and mind. From strange syndromes to unexplained illnesses, these cases keep us guessing and push the boundaries of our understanding. What are your thoughts on these medical mysteries? Leave a comment below and let us know if you find them fascinating, perplexing, or even a little bit scary. Thank you for watching and be sure to subscribe so you don't miss out on any of our future videos.